All right, so we're here with David today. He's suffering from left knee pain. Tell me, David, how long had you had knee pain?
About 2 years.
2 years. Have you tried doing anything to make it better?
Yes.
What have you done?
Inversion, cable,
Okay.
and just ice, cold, heat,
Okay.
things of that nature.
Alrighty. So what today we're gonna do today? We're gonna do some movements, and you can tell me if it bothers you, if it makes it better or worse. So let me have you stand up. Okay, good. Any pain there when you stood up? Let me have you step forward and then squat down. Okay, any pain there?
Yep, little in the knee.
Where in the knee?
The back and the sides.
Okay, so back in the, okay. Let me have you slowly go down the stairs. And then go up.
Right there, that's where the pain is.
Okay, so you have some pain coming down, you said?
I'm favoring this leg.
Okay, so out of all the movements that you did, which one was the worst one?
Probably going down and coming up.
The stairs was the worst one.
Yeah.
So from 0 to 10, what was the pain going down the stairs? What number?
About a 5 or 6. I mean,
Okay,
I
5.
can use it, but it hurts a little bit.
It's still painful.
Yep.
Okay. All right, you ready to start?
Yep.
1, 2, keep going, 3, 4.
1, 2, 3. 1, 2, 3, 4. How's that feel?
Pretty good.
Yeah? No pain there? What do you feel? You feel lighter, less pain?
What feels
No pain.
different?
No pain at all.
No pain.
Awesome. That's awesome.
No
That's what we
pain.
want to hear.
It's worth a little bit of discomfort.
Yeah.
There we go. So we just finished the treatment with David. How you feel?
Good.
Feeling great. I know you said you're feeling better walking, no pain. Let's try all the movements, see how it feels. Let me have you stand up. Any pain there?
Nope.
Great. Let's have you squat down. Wow, that was a good squat.
Yeah.
Any pain there?
Yeah, a little bit on the back.
Little bit. Okay. All right. Let me have come down slowly on the stairs.
Ooh, not used to it. No pain though.
No pain. Wow. You know, that was a tough one for you first.
Yeah, because I've been. Let's see. I just used my leg to lift up.
Nice. So
Yeah.
you feel you're happy.
Yes, because I used my leg to lift up the bad one. I haven't been able to do that.
That's awesome. Well, we're happy that you're feeling good. We haven't done the therapy yet, so let's do it. So you're happy with the positive result you got?
Absolute.
I love it.